My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a glucagon-like peptide 1 receptor agonist, GLP-1RA, is a medication primarily used for managing type 2 diabetes and weight loss? It has demonstrated significant benefits in reducing the risk of diabetic kidney disease, DKD, progression, a common and severe complication of diabetes. The mechanisms by which semaglutide achieves this are multifaceted and include its effects on glycemic control, weight loss, blood pressure reduction, and direct renal protective actions. Chronic hyperglycemia is a central factor in the development and progression of diabetic kidney disease. Prolonged high blood glucose levels lead to oxidative stress, inflammation, and the accumulation of advanced glycation end products, AGEs, all of which contribute to glomerular and tubular damage in the kidneys. Semaglutide effectively lowers blood glucose by enhancing insulin secretion and reducing glucagon release in a glucose-dependent manner. By achieving sustained glycemic control, semaglutide mitigates the hyperglycemia-induced oxidative and inflammatory damage to kidney tissues. Clinical studies have shown that better glycemic control delays the onset of microalbuminuria and slows the progression to more advanced stages of DKD. Obesity and overweight conditions exacerbate the risk of DKD progression through mechanisms such as increased intraglomerular pressure, renal lipid accumulation, and systemic inflammation. Semaglutide induces significant weight loss by promoting satiety, reducing appetite, and slowing gastric emptying. Weight loss improves renal hemodynamics by decreasing glomerular hyperfiltration and intraglomerular pressure, which are early contributors to kidney damage in diabetes. Moreover, reduced adiposity lowers systemic inflammation and decreases the production of adipokines and cytokines that contribute to renal injury. Weight loss also improves insulin sensitivity, further supporting glycemic control and reducing renal strain. Hypertension is a major driver of diabetic kidney disease progression. High blood pressure increases glomerular capillary pressure, accelerates proteinuria, and promotes nephrosclerosis. Semaglutide has demonstrated modest but clinically relevant reductions in systolic and diastolic blood pressure. This effect is partially mediated by weight loss but also involves direct vasodilatory and natriuretic effects of GLP-1 receptor activation. Lowering blood pressure helps reduce albuminuria, a key marker of kidney damage, and slows the progression of DKD. Semaglutide's blood pressure-lowering effects complement its glycemic and weight loss benefits, creating a multifaceted approach to renal protection. Inflammation and oxidative stress are central to the pathophysiology of DKD. Activation of GLP-1 receptors by semaglutide has been shown to reduce markers of systemic inflammation, such as C-reactive protein, CRP, and suppress pro-inflammatory pathways within the kidneys. Additionally, GLP-1 receptor activation enhances antioxidant defenses, reducing oxidative damage to renal cells and preserving kidney function. Dyslipidemia, characterized by elevated triglycerides and low HDL cholesterol, is another factor that accelerates DKD progression. Semaglutide has been associated with improvements in lipid profiles, including reduced triglycerides and LDL cholesterol and increased HDL cholesterol. These changes decrease lipid deposition in the kidneys, reducing glomerular and vascular damage. Proteinuria is both a marker and a cause of DKD progression. Excessive protein filtration damages podocytes and tubular cells, perpetuating kidney injury. Studies have shown that semaglutide reduces albuminuria, even beyond what is expected from its effects on glycemia and blood pressure. This reduction in albuminuria suggests direct renoprotective effects of GLP-1 receptor activation. Emerging evidence suggests that semaglutide exerts direct effects on kidney tissues. GLP-1 receptors are expressed in renal cells, including proximal tubular cells and glomerular endothelial cells. Activation of these receptors has been shown to improve renal endothelial function, reduce fibrosis, and enhance tubular cell survival.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.